Hello, my name's Dr. Chris Monk. I'm a consultant anaesthetist, and until recently I was the head of medicine. We're at the back of the old building of the Bristol Royal Infirmary, and this is the entrance that all patients will use if they need to come on a trolley or in a wheelchair, or indeed if a friend or relative is visiting and they have disabled needs. So we've now entered the corridor that everyone uses to get into the old building, and as you can see, it's not a welcome that we want our patients and their friends and relatives to have. It doesn't give you the feeling of getting better quickly. So we're now in the old corridor that links the old building to the Queen's building on the far side. Every patient journey comes this way, and it takes a porter and a nurse. And as you can see, it's constantly busy with deliveries at the same time. The above and beyond appeal is to raise the money to give a better environment to our patients. And this corridor is one of the major reasons that we are looking to build the new building. We're now in the old building at the base of the stairs. Because the buildings are separated by the road, all the clinical staff, having crossed underneath in the corridor, need to climb up these stairs to get to the patients. This costs time, which should be spent looking after our patients. The new building, centralising all the patients together, will mean that we save that time, and the excellent care they receive here will be done quicker on the other side of the road.
So I think with caring for the elderly, and we have lots of people who do have some cognitive impairment who become quite confused with moving around the hospital because it all looks so different from home, and I think being able to allow people to stay in smaller environments where they can build up relationships with other patients, and where they can have less stimulus when needed, but equally have more when they're getting bored and getting ready to go home.
The care of the hospital has been excellent. I've been here nearly 5 weeks, and it really has not slipped at all. It's been excellent, yeah. In a more modern building, it would be even better, because you've got the background there, and all the different equipment, and more cheerful looking. You know, this is an old Victorian building. There's no getting away from that. So with a more modern one, a bright, shiny, it would be really excellent.
And the Above and Beyond charity are raising funds for our new building, and there's going to be artwork. Do you think that will help for with the patients and their relatives?
Stimulation, definitely, because there's nothing to do, to be honest.
I think we need to do a lot more for our elderly, because God willing, we'll all be there one day, and we all hopefully may not need help, but if we do, we want it there. We want people that care for us and look after us in our old age.